my name is Jeremy. I'm a fourth-year graduate student in Jan's lab, and during my clinical immersion, I shadowed Dr. Linda Vedot, who is a breast cancer oncologist, and my project that I worked on during the immersion term was studying the efficacy of a novel chemotherapy involving copper chelation in treating advanced metastatic breast cancer. Next up.
I guess I can go next. I'm Nancy. I think I already introduced myself in the previous panel, but for those who joined now, I am a third-year PhD student in the Schaefer Nishimura lab. And during clinical immersion, I worked with Dr. Martin Prince. He's a radiologist at Weill Cornell and Columbia University. And my project consisted on developing a new way to image tissue expanders on breast cancer patients. Tissue expanders have a magnet on them, so it's really hard to image. But my work basically consisted on optimizing how we could image those magnets under MRI.
I am Nathaniel Wright. I am a first year in Yadong Wang's lab, and I did the clinical immersion before starting my PhD. And so during the summer, I worked on looking at strain in the heart using computer software to trace and analyze the strain in the heart, compare it with different machine learning techniques, and see how well the strain is able to correlate to heart failure. So the question, you're able to pick your clinician somewhat, in that you reach out to the clinicians. You can reach out to the clinician you're interested in, and they can choose to have you shadow them or not throughout the summer. And also, there's certain clinicians that will say you can shadow me for a day, but they don't give you a project. So during your time, you don't necessarily get stuck with just one clinician. You can see other areas as well.
Yeah, so to echo what Nathan was saying, quite often the clinician that you're paired with is somebody who your PI regularly collaborates with. I know personally, Jan was familiar with the clinician I worked with, Dr. Vedot, and pretty regularly your PI will help work with you to decide which clinician would be most relevant to either your research interest or work in the clinic. And I don't know if Nancy, you have anything to expand upon that?
Well, in my case, I kind of didn't pick the mentor that I was assigned to. It was among my option, but it was not my first option. It anyway ended up being an amazing experience. And I want to transition with that to another question that was asked. How closely was the immersion term topic related to your research topic? So in my case, I do neuroscience and microscopy. So I do biomedical imaging. And I was assigned to someone who does medical imaging, so MRI, CT. However, the topic was completely different from what I do in the lab, super, super, super different. I was working with breast cancer patients, and I work with Alzheimer's disease in my research. So, but I feel it was great, just being able to look at different perspectives, learn something completely different, and try to adjust yourself to a new environment, new ideas. And I feel it was great, even though it had absolutely nothing to do with my research. It could be different though. I know a lot of people, as Jeremy said, were paired with advisors that collaborate with their advisors at Weill. So that's good. But in my case, it was totally different.
Yeah, and I would say personally, my immersion term project wasn't very closely related to my sort of thesis projects. And I think the department, I did this, what, 3.5, 4 years ago. And in the time since then, the department's done a very good job, from what I've heard from the younger years, in relating your project during the immersion term directly to your thesis project, because I know a number of people have taken work from that and either gotten co-authorships on papers or have sort of incorporated this into either a chapter in their thesis or something along those lines. There's another question: how much exploring of the city? How many surgeries did you sit in on, and what was your reaction? So personally, my clinician, she didn't work every day of the week in the clinic. So in other days, she helped me match up with other types of oncologists. So I worked with a number of different ones to sort of see the entire chain of oncology treatment. And I sat in on a number of surgeries, including brain surgeries and lumpectomies of tumors being pulled out of people's necks. It's pretty grisly, but if you have the stomach for it, it is quite interesting. Just be prepared to stand in one place for 6 to 8 hours. Yeah, don't lock your knees. That's what they tell you, because you can pass out. Anything to add on to that, Nancy or Nathan?
Yeah, well, as Jeremy said, you have to stand up for a long time, so take care of your knees. As I mentioned, I work with a radiologist, so he was not doing surgeries, of course, but I wanted to see surgeries. So what I did was that I contacted some of my friends that were paired with an actual surgeon, and I asked them, like, hey, can I go shadow your surgery with you? And they were like, sure, let me ask let me ask my doctor. So they asked them, and if they said it's fine, then you can go shadow. So I actually shadowed a surgery in neurology because I'm interested in that, and I also shadowed a plastic surgery with tissue expanders. So even if your mentor doesn't do surgeries at all, you can totally ask somebody else to to if you can go with them, like, it's no problem at all.
Yeah, and along with that, so while my mentor didn't directly do surgeries themselves, I asked them, like, it's important when you're going to ask during, like, early on, say, I want to see these surgeries, so they have time to set it up and arrange it, because there are certain guidelines and regulations, like, you may or may not have to follow. They'll have to get through, and they'll be able to get you in contact with the people you do need. The director of the program himself, who works at the hospital, is very, very good at getting you into surgeries and other things that you're interested in, as long as you give them time. So as long as, like, right up front, you're like, I want to see this thing, or like, I want to see open heart surgery, which is what I told my mentor. And within like 3 weeks, I was able to get into the operating room and see that. So it's very cool and very open to you. But again, you kind of have to make sure you're seeking it out during that time.
There's another question regarding how much of New York City did you explore? And I think that a lot of people were able to explore a lot of New York City. It depends on, like, your work schedule, but in my case, I would work from like 8 to 5, and then after that, I would just go and do something, go to a restaurant or go to Central Park. The place that you will be living in is very close to Central Park because it's the Upper East Side, so you can just walk there. I mean, it's amazing. On the weekends, you can go to a Broadway show or Times Square. I mean, you can do whatever you want. I personally explored a lot of New York City. I went to Brooklyn, to Queens, everywhere. So I think it's a great experience, not only to be able to work in like a top hospital, like one of the best hospitals in the world, but you also get to be in an amazing city.
Yeah, absolutely. I mean, in addition to, having your regular work schedule, you can always just, it's not hard to get around the city with the subway, quite frankly. So if you want to see, you know, whatever you can imagine in New York, you can definitely get that out of your system over the 8 to 12 weeks that you're there. I don't know exactly what the duration of your stay is, but yes, it's a fun time. And somebody asked, do all the BME students live together during immersion? Yes. If the living situation is the same as when I was there, they have these large rooms. We had 3 people in a room. It's like a little bigger than a studio apartment, and might sound a little crowded, but you'll be moving around enough that it was never a problem for me, certainly.
Yeah. So you're all living together in a studio apartment, so it's not like but there's plenty of room. There's dining, you can make food. There's all the things you need. You don't have, you'll have to buy utensils and stuff, but there's, you have your stove, your oven, and water, so it's good. And no, the rooms do not have bunk beds. You each have your individual bed.
See a question, how did the immersion experience change how you approach research? And a couple of sort of similar things along those lines. I'll quickly answer did you get to pick who you lived with? I think Belinda has a sense of who gets along, so she will help you. I don't think we specifically requested who to live with, but she does seem to have a sense of, who works well together. So I know I was happy with who I was living with at the time, so I wouldn't be too concerned about that. So how did the immersion experience change how you approach research? I guess having just my research is not super clinically irrelevant because it's sort of basic science in a sense, looking at how cells behave in the body rather than like a clinical treatment aspect. But I think what is informative about the clinical experience is the sort of, constant reminder of everything you're doing has a direct clinical impact in the long run. So, like I said, I was working with a breast cancer oncologist, and frequently I would get to work with her and just meet patients, see what they're doing on a daily basis, and you can see breast cancer in all of its stages and how it really impacts people throughout their lives. So you have people who are sort of early benign cases, but they always have to come in, they have to, get lumpectomies and, relatively tough surgeries. And then you also see people who are in later stages of chemotherapy where perhaps they have brain metastases and they're, fairly low functioning. Essentially, they need to be supported heavily. And I think from a sort of emotional core perspective, it really helps inform why you're doing this research and why it will be important in the long run. I think you can both speak to that a bit, Nathan and Nancy.
Yeah, so the immersion term is not so much specifically related to what you end up doing in Ithaca or your final projects, but instead it kind of gives you a different outlook on how clinicians go about solving their problems, and as well as what their problems are. So that's a very different perspective than you're going to get here doing research in Ithaca, or even if you're doing research in New York, because during your time during the immersion experience, you get specific one-on-one time with your clinician or with the patients themselves, and you get to hear their side, which is much more, it's informative in a different area than what we're used to hearing all the time, just doing research.
I also relate to what Jeremy said. What I was doing was first of all, was not related to what I do and every day. And second, what I do every day is a lot of basic science and not very translational or clinic. However, being able to see the patients that you're trying to help, that's so amazing, I feel. And second, you can give like a different approach to the problems because you're an engineer, and they may have a problem that they don't know how to solve, but because you are from a different background, you can help them solve those problems easier. So I was optimizing like an imaging protocol, for example, and that's something that we do in the lab like every day. We're trying to optimize our research and see what works best for our experiments. So I think that we were able to give them that, and they were also giving us all the clinical knowledge, the interaction with the patients, the actual be in the surgery room with them, and having that one-on-one time with them, as Nathan mentioned. That's pretty cool. Yeah.
We have another question here. How often would you say people continue to research in New York City after the immersion term instead of returning to Ithaca? I would say that's fairly uncommon. I know there are a couple of students who have pursued their PhD working with Yi Wang, for example, who is down in the New York City campus. But I think what is more common is for people to either take on a clinician as a committee member or to pursue publications with some of the clinicians down in New York City. Because I know there are a handful of people, I believe Ewan Devlanic's lab has some pretty close collaborations where they directly collect, primary samples to be analyzed down at New York City. I know other members of my lab in the past have collected primary breast cancer samples to test the cells from. And I believe there are a number of people in more orthopedic focused labs who will directly apply their research to the clinical basis down in the Hospital for Special Surgery, which I believe is one of the best orthopedic centers in the world. I don't know, it shows up a lot. So it's one of the bigger ones. I don't know if anyone has anything to add to that.
Yeah, I would agree. So continuing, or when you first decide on which lab you want to join, a lot of you're choosing a PI, and it can be a little difficult to rotate with someone down in New York, but there is that option, and you'll just have to kind of choose based on what you're interested in. However, it's basically up to you if you decide to join a lab down in New York, but that's normally going to be within your first semester is when you're choosing that. So it's uncommon, but it's not impossible. Nor is it like you're not told you can't do this. It's more of just know what you want to do.
There's a question about how often do you say people continue to do research in New York City after the immersion instead of returning to Ithaca. So I think it depends on what you want to do and what your research path is. I know that Ji-Wang's lab, which is in radiology, is based in New York City. So if you're interested in radiology or biomedical imaging, it is a possibility that you can do your rotations in New York City, that you can work with a clinician in radiology, let's say, while you're there, and you just stay there if you want to work with Ji-Wang, and you basically never return to Ithaca after that. In other cases, I would say that's not really common. I mean, all our labs are based here in Ithaca. So unless, I forgot to mention, there's another lab in MSKC, Memorial Sloan Kettering Center. I forgot the name of the PI, but no, he works with cancer. I don't know if any of you guys remember the name, but you can also do a summer immersion with them and stay there.
So with regards to the stipend and the housing in New York, so since housing is covered, you also get the stipend that you would normally get back here in Ithaca plus a little more. So I would say that all the living expenses like food and entertainment, it's not an issue while you're down in New York City. You don't have to worry like about you're not going to starve or have issues with that.
Definitely, New York City is a bit more expensive than Ithaca, so you will spend just more money on food because you're also not gonna cook that much, so you have to eat outside most of the time. But as Nathaniel said, like housing is provided. Maybe you can like sublease your apartment during the summer, and that will give you like extra income while you're in New York City. But other than that, you also don't spend money on transportation because where we live is like next to the hospital. So you will be mostly walking. So I would say that you mostly spend your money on food and entertainment. That's all.
In that regard, it's pretty much up to you how much you want to take advantage of being in New York City. If you want to, hit up all the fine dining places and go to Broadway shows, which is a blast, and in some cases is probably a once in a lifetime chance, you can argue it's worth it. On the other hand, if you want to be really fiscally conservative, responsible, whatever word you want to use, for your PhD, you can just eat spaghetti for a while. You could survive. Depends on what your priorities are. Somebody asked what form of transportation was used to get from housing to the hospital. You are like right next to it. It's very close. It's, I don't know, as long as we're in the same place we were 4 years ago, it's like a 5-10 minute walk, if that. So that's really not an issue.
It also depends on who you get paired with.
Okay.
My mentor, his office while Cornell Imaging was located like 10 blocks away from where we were staying. So I had to walk maybe like 20 minutes, but that's totally fine. And somebody else from my cohort got paired with someone in Brooklyn. So she had to take the subway every day to go there. But yeah, as Jerry mentioned, you're living like next to it. So it's 5-minute walk.
Yeah, the majority of people are right across, like just 1 block away from the hospital itself where you live. So it's not that much of a worry. As far as getting other places in New York, taking the subway is a great option and it's not that expensive. It's probably not best to get a subway card, like the monthly subway card, unless you plan on using the subway every single day. It's not going to be worth it. So just kind of get the card and refill it as need be, because you're probably not going to be going down to Brooklyn every single day. So that's not necessarily a worry. And during the immersion, I did not buy scrubs. I don't know anyone that did, because like when I went into the operating room, they have special scrubs that they give out to people.
Yeah.
Okay, everyone, we're going to give a couple more minutes and excuse me, wrap up this call of the immersion. The next panel will be our housing panel, which I see some people jumping on this call. So any last minute questions? And again, the group will be happy to send out, they've all been added to the group me. If not, they'll add to the group me, and you guys can definitely post your information, even in the chat, to your email addresses if they have any further other questions.
But if it was hard to continue your research in Ithaca after you got back, I don't think so. Maybe it's just hard to get into the routine back again, but that's normal, and you will take some time just to adjust. But yeah, I don't think there's a big issue. It's often after your first year and you're kind of trying to see what your project's going to be on. Probably while you're there, you're going to still be working on stuff from Ithaca. So yeah, I think it was not hard. It was fine. Yeah.
Okay, we're going to wrap up this panel. I appreciate my current students very, very, very much for all your help. Again, they will post their emails at the chat, so if you guys have any questions or concerns, they're here. Virtually all the students, except my first years, have gone to immersion term. So if you have I know a lot of you have buddies and stuff, so you can also reach out to them. Any other last minute questions? And we're going to flip over to our housing panel starting at 1.